Hi, everyone. Welcome back to our talk for Minority Mental Health Month. We're going to be talking today about BIPOC self-care, and I'm so excited to be discussing this with Kaela. I'm going to let her introduce herself, tell you a bit more about herself and where you can find her. You can find her handle for Instagram in the comment section, but she has amazing stuff on her page. I love her things that she post, and I'm just really looking forward to our conversation today. I'm so sure she's going to be able to give such amazing insights and knowledge, and I've learned so much from you, Kaela, from Instagram. So I'm really excited to bring you on today and talk to all of us. So yeah, I'll let you introduce yourself, and then we can jump into talking about BIPOC self-care.
Sounds good. Thank you so much. I'm super excited to be here. My name is Kaela Farrise. I am a licensed therapist located in the Bay Area, California, but seeing clients virtually, so all over California at the moment. I run Therapy While Black, which is an organization that I created just to help kind of combat stigma around mental health care and mental illness in the Black community, and also to help clinicians learn about working with Black folks in particular, but people of color kind of more generally, so we can have some more culturally responsive care. In my practice, I see women and children, mostly, or women of color and children, with a focus on trauma, but stress management and self-care are a huge part of that. So I'm really excited to be here and to chat with you.
Great. Yeah, I'm so happy that you're, well, first of all, available, and also for this topic, because I know you have so much to bring, because a lot of the work that you do is intertwined with self-care and what it means to heal, and so much of that is a process of self-care. And so yeah, I'm really excited to talk about that. And one thing that both of us have in common in our clinical practice is our importance that we place on multiculturalism and multicultural issues. And there's so much that culture brings to the room, right? There's no way to be working with clients without acknowledging their racial, cultural, ethnic backgrounds. And so I want to start off by even talking about and asking the question of how minority mental health and multiculturalism informs your clinical practice and why it is important.
Absolutely. Yeah, it's definitely the basis of the work that I do. Obviously, I'm a person of color and I work with people of color. And so being culturally responsive is really important when we think about creating safe spaces for folks to feel seen and heard and understood. But even beyond that, I get so many inquiries from folks who have unfortunately had a harmful experience trying to get mental health care with folks who weren't appropriately kind of trained in cultural responsiveness. So for me, it is everything, right? Because our clients need to feel safe in order to really be able to open up and talk about the things that are important. And it's important to not feel judged and for people to be able to validate their experiences. So that's kind of the personal, but also like having an understanding of how people are situated in the world makes us better clinicians. So sometimes we can think about it with trauma, but it applies to cultural things as well, where, we have something that we're saying maybe is a distorted thought pattern, when really, like, based on a person's life experiences, that is a reasonable thought that they're having. And I see that come up all the time when we talk about instances of racism, especially if they're not super overt, where sometimes they're missed, or, things aren't quite understood in the way that they should. And then people don't come back, or they don't seek out mental health care because they don't feel like there's someone that understands them. So it can be really detrimental. So it's definitely something I'm passionate about. And it's so important that, no matter who you're serving, that you're kind of getting that training and like understanding what's going on there, especially right now with everything going on in the world.
Totally. And being able to really understand the role that someone plays in the world too. I really liked how you said, like, externally too, right? We have to know how our clients fit into the systems around them, and these systems can be oppressive, especially
Absolutely.
when working with people of color. And I mean, both of us are people of color as well, and we have our own identities, and our clients have their own identities. But being able to understand each person's identities, the differences in their identities, and also how it applies to their mental health is so important, because one person is not going to be the same as another. And I think mental health care, it was still based, right, on white practices and Eurocentric values. And so being able to unlearn some of that and be able to look at it through a multicultural lens, because as you said, right, and it's so true, it could be harmful otherwise. It could be
Right.
making assumptions and even like psychologically harming our clients by invalidating them. So
Mm-hmm.
it's the basis of everything, which is why it's so important to talk about. And I think we're going to have a great conversation about it today, since we both acknowledge that, and it really informs both of our practice. So I think that it'll be a great conversation. So with that in mind, with kind of how we function, I guess, in the room, I'm going to ask just generally, what is self-care? I'm sure a ton of people see it on their Instagram feeds. I know that I do. But in your words, what would you say that self-care is?
Yeah. I would say self-care can be an action or series of actions or kind of even thoughts. It doesn't even have to be an action that's taken to maintain or increase one's well-being in like one of the wellness domains. I think the World Health Organization has 7, but chief among those are like physical, mental, spiritual well-being, among other things. So things that we're doing hopefully to maintain a level of wellness or increase our current level of functioning. Not necessarily physical things. It can also include like the way that we're thinking about things and talking to ourselves and stuff like that. And it doesn't even have to be things in the moment. So it could be, things that we're planning for the future, the way that we're situating ourselves in the world, things like that as well. But that's how I would define it.
Yeah, great. I love that explanation, especially because it encompasses a lot. And I think sometimes self-care can encompass a few things, and the main that I've seen is like bubble baths and yoga and drinking smoothies, but there's so much more to it, and it doesn't even have to be in the present. I love how you brought up in the future as well. That's something that I honestly haven't really thought about. Like, I've thought about how self-care can be future practices, but I didn't differentiate how so frequently we look at it as present practices, but it can encompass a lot more. So thank you for that insight. That even has me like, when you said that, I was like, oh, that's so true.
Setting ourselves up for things in the future can definitely be a self-care practice.
Yeah, for sure. And so with all of that in mind, the next question that I have for you is, how does self-care look different from person to person?
Yeah. I feel like that's a super difficult one to answer just because it is so individualized. But I like that example of the meme that you gave of like, it's supposed to look one way, because I think that's the main thing that really like needs to be just axed out of the conversation. There's a very limited view of what it can be. And so when we think about, for instance, future orientation, right? Making sure that like our bills are paid on time, or like whatever the things that are going to allow us to keep our stress levels low, that could be self-care. And that's not something that we normally think about. But there are a lot of things that perhaps in Western culture, like don't necessarily fit in the same way, or kind of dismissed as self-care practices that in other cultures are really like a central part of it. That might include, music or dancing or just kind of connecting with others in different ways, where in kind of a more individualized culture, those things aren't as important. But it really just depends. And I think that is the important thing, that we are not putting ourselves in a box of like, this is what self-care should look like. And then those things don't end up actually helping us, or we feel bad that we're not doing it a certain way. So we start kind of self-blaming or self-shaming, right, about how we are taking care of ourselves when, we're going outside, we're gardening, we're taking care of things that need to be done. And those are all self-care practices that we could be proud of with a different framing.
Yeah. And it's so true that what self-care looks like to one cultural community can look so different, especially like storytelling, narrative telling, singing. That is part of so many other cultures worldwide. I know that it's not as much of a Western practice that I've seen, but I've seen it even in my community, and I imagine that without that multicultural competence and looking through that lens, that some people might misinterpret it as like, oh, is that relaxing? Or that seems like being like doing, you should be relaxing, when that might be actually serving a function of taking care of someone's psychological health, bringing their stress levels down. And so that, I think, really ties back to what we're talking about with being able to recognize these multicultural practices and seeing why that activity might be important to a client. Because just because for us, we might think like that doesn't sound like self-care to me. It might be to another person. So being
Mm-hmm.
able to have that kind of self-awareness.
Right.
And how would you suggest to people who are struggling to navigate self-care? So we talked about this even a little earlier, that in some cultural communities that self-care isn't the norm, right? Like especially in collectivistic cultures where we're with a group and doing for others, sacrifice, that is something that's more the norm. Self-care is something that I know a lot of BIPOC feel guilty for doing. So the next question I have for you is, how would you navigate self-care when it's not the norm? Like, what would you tell someone about that?
Yeah,
Subject?
that is a great question. And it's definitely something that comes up a lot. So I think the first thing is just like normalizing that it can be hard. And there are sometimes big feelings associated with it. Like sometimes we do feel guilty, or we feel like we should be doing something else. And so like recognizing that that's a thing. It can be hard when it's not something we kind of were raised to be focusing on to shift. I think framing is also really important, right? Because sometimes self-care is collective care. And so not kind of underutilizing like what we can do in a group is also really important to make sure that we're being kind of culturally responsive and competent. What I would say is that we don't always have to feel super good about the things to do them. I think that's somewhere where people often get caught up, is like, when I feel good, like then I can do the thing. And especially when we're shifting a practice from something where maybe there were some kind of negative or neutral feelings about beforehand, it takes a while. And that doesn't mean that while that kind of feeling is shifting, we don't have to be, or we can't be doing the actions, right? So we can think about what are the things that would be helpful for me to be doing more of that are in my control. And can I do those things even if like they don't really fit? Like, can I try on something different without feeling super good about it to begin with? And we know that like practice over time will change how we feel about it, and will change kind of how we think about it. So we don't always have to feel super good about the things. We can just be curious or neutral and kind of see, test it out, and see, and then notice how it does change how we feel. And if, it doesn't, then perhaps it's not the right practices. But I think kind of separating those two things sometimes can be really helpful for folks. And then the other thing is recognizing like what we are doing that is helpful. So it doesn't always need to be this huge kind of shift in routine from like, I've never, I don't know, going back to your example, I've never taken a bubble bath, so I'm going to take, 8 bubble baths a week or whatever. We can recognize the things that help us to feel good and that are not harming us, and do more of that as an intentional practice. Like, I really like talking to this friend. I'm going to schedule some time to do that to make sure that I get it in. I really like going outside. I really like doing X, Y, and Z. Like, usually people kind of know what are the practices that make them feel good. And so it's not so much about like identifying them, but giving ourselves permission to take up that space to do it. That can be hard. And sometimes we do feel some things. We feel a little guilty. We feel the things, and we can still do it. It doesn't have to mean that, we wait until we feel better. So that's what comes to mind initially.
Yeah. That's really helpful advice, I think, because with self-care, I think there's this misconception that it always has to feel good, or you have to feel relaxed and it has to be enjoyable. But, there might be other feelings associated with it. And I really love how you brought up that thing of curiosity. Like, as long as you're curious about it and to reflect, and does this make me happy? Like, do I enjoy this activity? That allowing yourself to take up the space for that. And so I think even reflecting on maybe like at the end of a week, like what were some things I enjoyed doing during this week, and then allowing yourself to do it again. Because I think when it comes to self-care, what I've seen is people almost, I don't know, they become like a deer in headlights when you're like self-care practices. And it's like, feels like such a hard question. That's like, what is self-care? What does it look to me? And I just love how you brought up, it's almost like the simplicity of it. Like, what do you enjoy doing and what has made you happy? And then allow yourself to take up the space for it.
And I think that, sometimes people are like, well, I'm doing these things, but I don't know if it's self-care. And sometimes it's not, right? Like, not everything that we like to do is, I would consider a self-care practice. I think A good distinction is how you feel after you do it. So for instance, for me, when I get really stressed, one of the things that I know I do is I like binge watch Netflix, right? But afterwards, I don't feel good. I don't feel better. It's like a distraction and it kind of gets me through the moment, but it doesn't actually help to like replenish or kind of restore how I'm feeling. Whereas other practices, taking a walk, talking to a friend, things like that actually do help me to feel better after it's over. And so that's kind of one metric that people can use to kind of figure out like which of these things like might we consider self-care and kind of focus on if there are multiple things.
Yeah, that's a really good idea. I think that can be really helpful for people too, to just be able to have one thing to focus on and like, did I enjoy this? Did I not? Like just reflect after, and it involves slowing down. It's like a good practice that I think, especially in this day and age, it's really hard for people to do. So that aspect of slowing down that you suggested, I think would be really valuable for a lot of people. That's like a great segue into my next question about just like self-care, the importance, but to focus a bit more on what we're talking about for Minority Mental Health Month, BIPOC Mental Health Month. Why is BIPOC mental health? One, why does that matter? And then two, why is self-care a must in the BIPOC community?
Yeah. The first thing that always comes to mind is that if we don't take care of ourselves, or if we don't kind of make intentional time to, then like our bodies will do it for us. Right. And so oftentimes, especially in people of color communities, we kind of move to needing to take time off or like make time for ourselves, like when we are physically ill. And a lot of those things, especially when they're stress, or like stress can manifest in your body. Stress, anxiety, depression, all of those things manifest in our body when they're not expressed appropriately. And so it looks like, I have clients who will come to me after they've had their first panic attack. And a panic attack, oftentimes, especially for Black women or people of color, means that they went to the emergency room because they were having chest pain. It doesn't look like what we see on TV. Right. And so we know that like, because we sometimes somaticize, we push things into our bodies. Then we recognize like, oh, there's something really wrong and I need to take some time off, or I'm forced to take some time to kind of address this and figure out a practice. So I think one, it's about sustainability. It's about being healthier and, making sure that we are kind of in it for the long run. I know in the past few years, there's really been a hyper visibility of some of these issues that really hit home in BIPOC communities. And it's a lot. It's just a lot. It's a lot to watch people that look like us, be violently handled and murdered and all of these, and disappeared, and all of these things that are coming up in our communities. And it does have a toll. And so, over time that wears on us. So I think it's one about just like making sure that we can be healthy in the long run and have kind of some sustainable practices, whether or not you're kind of, actively working in the movements or just like taking in this sort of content daily, like that has an impact on us. So, I guess I'll stop there, but it's a lot going on right now and we just have to have ways to manage it.
Yeah, I think just like really highlighting, I mean, the events in this past year and a half, there's been so much in the BIPOC community, so much in the Black community that it's important to talk about, it's important to recognize, but it's also, like you had said, self-care can also be community care. So acknowledging things that are going on, and also just acknowledging that it's hard, it's unfortunate, it shouldn't be happening, right? Like, and it's something that we need to take care of ourselves, and allowing, I think, especially in BIPOC homes, there might not be that norm of taking care of themselves, but it's like in these times, we have to, and it's really draining on mental health, and it can be psychologically harmful if we don't take the time. And as individuals, as communities, it's such an important practice.
Mm-hmm. And I think, one of the things that folks often come to see me for is kind of relational distress, or like things that are coming up in relation with other people, kind of trying to figure out how to navigate talking about these things. And like that can bring up a lot. So, setting boundaries is certainly a form of self-care, and it's one that's really hard sometimes to do, and we don't necessarily learn how to do as kids, but it is so, so important. and can really make a difference in the type of capacity we have to show up for the people that we care about and kind of allow them into our worlds in a way that feels good. And the other thing that I'll say that's not super related but kind of related is just that I often hear folks kind of coming, especially in this time, like really being down on themselves about the self-care practices that they do have, or like being really confused about why they're not working. And, you know, sometimes people do have things where they're like, these are the things that help me to feel better, and they're not working. And so like this doesn't help. This is not helpful. And there are two things. One, I think some things are a practice, and they just take time to kind of get to a place where you can institute them in a way where it does feel good. Breathing is a breathing practice, or like a deep breath practice, is something that I think comes up in that category a lot, where people are like, I don't, like, people tell me to breathe and like I don't understand, but it is something where you like have to practice it, and it is really, really helpful when you get to a place where it's good. And the other thing is that the coping practices that we had pre-pandemic, you know, a few years ago, or even like 6 months ago, they might not be enough to get us through this current moment. And that's okay, right? It doesn't mean that they're bad practices. It doesn't mean that you're doing something wrong. It just means that we constantly do need to be reevaluating our self-care practices to make sure that they are up to the standard, especially like during really tough times. This is a really tough time, right? So your normal self-care practices might not be the same as your self-care practices on a really tough day. And it doesn't have to be an individual experience, right? We can ask ourselves, what do our loved ones, our colleagues, our whoever the people are who are in our circle, what do they need to know about my triggers and my self-care needs? So how can I communicate those things to them? Or that things are coming up for me, what kind of conversations do I need to have so that I can make the space, or have the space made for me to have those needs met in a way that doesn't feel bad. Because I think that's the other thing that comes up. People are like, you know, I need to take some time for myself, but I'm worried about how people are going to feel about it. But talking about it even beforehand can be really helpful. So practices before, it might not be the practices that help us right now. It doesn't mean they're bad. It just means we need to reevaluate.
Yeah, that's really, really great advice, because I mean, as circumstances change, coping strategies change too, but that doesn't mean that there's anything wrong with our coping strategies. And the second point that I thought of when you were speaking was that when we talk to other people and communicate with them our triggers, what we need for self-care practices, I was thinking that even that could have like a ripple effect, and that might also be modeling for another person, for them to be able to empower themselves and take care of themselves, know that that's okay, and almost be like permission, like help them with the permission to allow themselves. So I'm sure that even those kind of acts can make a greater impact than just on ourselves, but for other people too.
Absolutely.
Yeah. Well, this conversation has been so insightful, and I mean, I even have learned so much. There's a lot that I think even after we hop off the conversation, I'm going to be reflecting on, and I'm sure we'll bounce back and forth chatting about this after. But I really appreciate you taking the time to talk about this with me. Self-care is so important, and as we both said, I mean, times have been just like tough. I feel doesn't even encompass it, but it's so hard for me to even come up with a word like how tough things have been. The BIPOC community, and self-care is just so important, and so I'm glad that the two of us have been able to talk about this. I do want
thank you for inviting me.
Yeah, I'm so glad that you're able to join. Thank you for that. I do want to give you a little bit of an opportunity to tell some of the people who are watching this, where can they find you? So this video is going to be on IGTV. It's going to be on YouTube. Where can some people find you and learn more about you?
Absolutely. So people can find me on Instagram at therapywhileblack. And you can find me otherwise on my website, which is my first name, last name, Kaela, Kaela Farrise, F like in Frank, ARRISE.com. And that links to everything. Folks can feel free to hit me up with questions and whatever else, but I'm looking forward to connecting.
Right. Thank you so much, Kaela. It's been so great to chat with you, and I just look forward to seeing more on your page. I always love when I see you on my feed, so thank you for all that you do, and thank you for being here today.
Thank you. You too.
All right. Bye.